Hi, this is Alexis, and this is my assistive technology case study. So I decided to do mine about Jamie. Jamie has been diagnosed with an acute angle closure crisis that caused glaucoma in his right eye, and he had lost all vision in that right eye. And doctors say he is starting to lose vision in his left eye, but is starting to use more aggressive treatments, some beta blockers and eye drops to help prevent total blindness. And right now for adaptions, he is using a screen reader to enlarge documents. He works as a real estate agent and has to read a lot of papers and has been matched with a guide dog as well. So some of his goals is wanting to become more active because with losing his vision, he hasn't been physically active as much and has experienced some weight gain. So he signed up for a skiing trip through a recreational association. And his main goals included increase of types of recreation, enjoying some of the activities before his vision loss, including soccer and making his own beer, and then increasing independence and physical activity. So there are a lot of different types of adaptive equipment for those who have disabilities. And the most common adaptation for ones who are struggling with vision blindness or total blindness is skiing with a guide. And the guide helps give descriptions as to where your body should be moving, what's in front of you. Usually there's nothing in front of you, but just in case there's like a little bump in the ski slope. I've never been skiing before, but I'm kind of familiar with it, but kind of help just guiding him and giving him ideas of where he needs to be and where he needs to be going, also by being right by his side in case something were to happen. And the technology that I found to be really helpful in this situation is called an Amplivox belt blaster. And it's kind of like a megaphone fanny pack type thing. And the guide wears it and it just delivers a much clearer sound, which makes it a lot easier for the skier to be able to hear the directions, because I assume being outside, there's a lot of people that are still going down these hills. There's a lot of outside noises and wind when you're going down the slopes. So this just makes it a lot easier to fully hear clear directions. And it's just worn on the waist of the guide. So some of the benefits for using this technology is allowing the guide to move freely, not having to hold anything besides the grippy things, the track things. And it's considered comfortable and non-obstructive and non-invasive. And it also helps the skier, Jamie, get a little bit more sense of independence since he's not having to hold on to the guide. And if he feels comfortable enough, he could have a guide that is further up or a guide that's further behind him, so he feels like he's in his zone doing his own thing, but he still has those guides right by him too. So I have a quick 2 clips to kind of show what it is.
Here we go. I'm going straight down and turn left, go, turn right. Go. American businesswoman Mary Kay. Dog, and I like that.
The big dog.
I like that. Coming along. We're going to take right off here. Get the speed up. Speed up. Get the speed up. Good. All right. Go.
So you can see from that video that you could clearly hear what the guide was saying, and it was giving the skier a good amount of space to be able to move freely on his own and feeling like he's independent doing it by himself and not feeling so invaded by the guide. Some considerations and impacts that we need to watch out for is checking where his physical stamina and his balance is before starting the exercise. He hasn't been physically active for a while and has some weight gain, so we're not sure if his stamina may have gone down since his diagnosis, and kind of just seeing where he's at, like starting at a much smaller hill and then building up from there. And then also watching out for his blood pressure too, before and after each ride. Since there's a family history of high blood pressure, we don't want that to get too high and get out of control. And then also just making sure that Jamie's hearing is in good condition to be able to hear the guide as he's going down the hill, because if he has any trouble with hearing, he won't be able to hear the directions and won't be able to go down the hill, which is why the amplifier is so important, so that Jamie can hear what he's supposed to do. And the considerations don't really impact too much of the technology being used. It just, unless Jamie has severe hearing loss, which it is not listed in his medical history, but that is still something to keep an eye on just in case. And these are my sources. Thank you.